So, good evening, friends. Welcome back to the first episode of Quarterfinals 1. So, Brain Teasers in association with Ophthalmological Society of Nagpur presents Big Q. So, this is the signature tune of our Brain Teaser. And this is the signature tune of Big Q.
आठ समंदर अपना अंबर
साला तो
खोज
जीतना
ले
ही
अब तू अपने दम पर भूख मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर आठ समंदर अपना अंबर खोज ले अब तू अपने दम पर भूख मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर खोल दे पर खोल दे पर खोल दे पर खोल दे पर बंद घड़ी की भी रुकी हुई सुई होती सही दो दफा चुप क्यों है रहना मन का तू कहना रोके चाहे हिचकियां खोल दे पर खोल दे पर खोल दे पर
So, we welcome you to the first episode of this quarterfinals, and I welcome our quiz masters for today's episode, Dr. Manisha Nadda ma'am, Senior Professor and Head VR Services, RIO PGIMS Rohtak, Dr. Madhu Udaraju, he is a Chairman and Managing Director of Ramana Raju's Vision Tree Eye Hospital, Vishakhapatnam, and Dr. Nilutparna Deori, she is a consultant, Department of Pediatric Ophthalmology and Strabismus, Sri Shankaradeva Netralaya, Guwahati. So this is the promo from our microvision team. I especially wants to thank Mr. Ashok sir, Navneet and Mr. Kumaran for their support and pushing us to start this season. And there was always a strong financial support from this team. So if we did not acknowledge the field force they have worked, so it will be like they have enrolled all the PGs from across the country. And last but not the least, the smooth and flawless execution of this big Q platform and the BT platform and all the registrations, live quizzing after every episode, it is all taken care by the Numerotech team. So I thank Mr. Sai and his team for the same. So now let's quickly see the format of quarterfinals. So there will be 4 quarterfinals. Total 80 teams will play the quarterfinals. So 20 teams per quarterfinal. And today is the first quarterfinal. Second quarterfinal will be next Wednesday, that is 27th March at 8 p.m. So for teams, you have to log in from 2 platforms, that is Kahoot and the Zoom platform. You have to log in from 2 devices but 1 email ID. The first screen is a live quizzing, that is Zoom platform. Out of 2 rounds, one will be played on the Zoom platform, that is face to face, and it will be only for the teams. The second screen is the Kahoot platform, which is for the MCQ round, and it will be played by both audience and the teams. So 5 out of 20 teams from each quarterfinal will qualify for the semi-finals. And what is the criteria? It is the respective quarterfinal marks plus the best of your 5 preliminary rounds will be calculated. So we have 3 sets of MCQs. So 5 questions in each set. It will be played by both teams and the audience. There will be no negative marking for the same, and you will get 10 seconds per question. Now coming to the second set, that is the rapid fire round. It will be played by only the teams, that too on the Zoom platform. So 5 questions will be answered. You have to answer the 5 questions in 30 seconds. And there is negative marking in this. For correct response, you will be given plus 10. And for every incorrect, it will be minus 5. If you pass the question, no marks will be given or even deducted. One thing main important is that both the teammates should be there to play the quiz. If only one member will be there, you will be disqualified and will not be eligible for qualifying for the semi-finals. So teams which did not qualify for the quarterfinals or which are not in the quarterfinals one, that is in quarterfinal 2, 3 and 4, you can also play as an individual as an audience. So these are the prizes for the postgraduates in the finals. Mentors will also get the gift. And these are the audience prizes per episode. Even for today's episode, these are the first, second, and third prizes for the audience. So now let's test our Kahoot platform by this sample question. Which date will the new IPL season begins? And your options are A. 20th March 2024, B. 21st March 2024, C. 22nd March 2024, and D. 23rd March 2024. And your time starts now. So the time is up and let's see what is the answer. Answer is C. From 22nd March, the new IPL will begin. So now I invite our first quizmaster, Dr. Madhu Udaraju. He is a chairman and managing director of Ramana Raju's Vision Tree, Vishakhapatnam. He has done more than 2,400 corneal transplants, 2,800 plus refractive surgeries. His accreditation of refractive surgeries is from Singapore National Eye Center. He has done his international fellowship from Unimore, Italy. He was the first to perform Bowman's layer stromal transplant for advanced keratoconus in India. And he won the award of International Education Award in 2020 and International Scholar Award in 2022 from American Academy of Ophthalmology. He has won many Best Paper Awards and Video Awards. He has 9 publications in international peer-reviewed journals to his credit. Over to you, Madhu sir.
Thank you, ma'am, for the kind introduction. It's great to be back at Brain Teasers. Thanks to Prashant sir and you for always making me part of this wonderful endeavor. So can we start the quiz now? Yeah. So I think 5 questions now, the section 1. I'll start with the first question. The risk of plate haptic silicon IOL posterior dislocation can be reduced by which type of laser capsulotomy? 1. Spiral pattern, B. Square pattern, C. Octagonal pattern, D. Cruciate pattern. And your time starts now. The correct answer is spiral pattern. Right. So next question. A patient with pseudoexfoliation syndrome has increased risk for which one of the following complication? A. Traumatic mydriasis, B. Corneal edema, C. Poor IOP control, D. Anterior capsular contraction. And your time starts now. And the correct answer is anterior capsular contraction that we see postoperatively. The third question, most common organism that causes infectious crystalline keratopathy. A, Streptococcus viridans, B, Staphylococcus epidermis, C, Streptococcus pneumoniae, D, Staphylococcus aureus. And your time starts now. Yeah. And the correct answer is Streptococcus viridans. This is most commonly we see post-transplants or sometimes even in cases where there already been an ocular surgery. Next question. Corneal injury from UV radiation causes which one of the following? A, damage to the stromal collagen. B, loss of epithelial cells. C, thinning of Bowman's layer. D, loss of endothelial cells. And your time starts now. And the correct answer is loss of epithelial cells. And the final question for today's MCQ in round 1. From the greatest to least, which one of the following describes the frequency of recurrent corneal dystrophies in a graft following PK? So already you have done a PK. So what is the highest chance of seeing a recurrence in these grafts? Option A, Fuchs, granular, lattice, lattice, granular, macular, Fuchs, lattice, macular, granular, lattice, macular. So which one has the highest recurrence? So grade according to the highest chance of recurrence to the least. And your time starts now. And the correct answer is B. Lattice has the highest chance of recurrence, followed by granular and macular. So in the recent studies, they have shown that if you cross-link the donor corneas, the recurrent rates can come down in some of these dystrophies. So that finishes the first 5 questions. And it's my honor to introduce my co-quizmaster, Manisha ma'am. She is the senior professor and head of VR surgery at RIO Rohtak. She has more than 25 years of teaching experience, and her main area of interest is retina, uvea, phaco, SICS, neuro-ophthalmology, including electrophysiology. And she has a whooping 250 presentations and also 55 publications in indexed international and national journals. She has held several positions in states and state and national societies, and she has won the excellent award for chief editor of Haryana Journal of Ophthalmology 2022 and award of distinguished ophthalmic professor award 2024, and also award of excellence from the president of HOS. She also has an interest in Kathak, and I welcome you, ma'am, and now hand over the session to you.
Thank you, Dr. Madhu, for this wonderful and nice, kind introduction of mine. Here I thank Dr. Prashant Bavankule and Dr. Shilpi for giving us this opportunity to be on this platform, which is a national platform, and students they learn a lot from this. So first of all the best to all the participants of this quarterfinals, and we are going to have a rapid fire round. So be ready, be observant, be enthusiastic, and do it at your best. So here we start.
Yeah. So now I invite team 1, House of Dragon. So Dr. Subhiksha and Dr. Vinodhini. So please unmute yourself and start your videos. And please introduce yourself.
Good evening, ma'am. Ma'am, good evening, ma'am.
Good evening.
Good evening to you.
Hello, please introduce.
Ma'am, this is Subiksha
evening.
from final year PG from Coimbatore Medical College.
I'm Vinodini, final year PG from Coimbatore Medical College.
We can only see Subiksha.
Yeah.
Yes, little bit more shift towards Subiksha.
Your
Vinod.
camera. You can see your image in the small box over there.
Sir, we are not able to see, sir.
Okay, no issues. Slightly tilt your camera towards.
Vinod.
Yeah.
Vinod.
Yes,
Okay, sir.
that's fine.
Okay.
Okay, sir.
And so please do introduce yourself, tell about your mentor, and then we will have your rapid fire round with Dr. Manish.
Our mentor is Dr.
Good evening,
Jeeva
Dr.
Kalam.
Manish. Yeah. Please go ahead.
Good evening, sir. Our mentor is Dr. Jeeva Kalam, ma'am.
Fine. Over to you, Dr. Manisha.
Right. Can I have my slides here? So the
Pass.
first question
Pass.
is,
Pass.
yeah, we are starting. The rain cloud sign is seen in patients with dash and
False.
ophthalmitis.
Pass.
Mullers muscle is responsible for approximately 5 millimeters of
False.
eyelid elevation. True or
False.
false?
False, ma'am.
Rate of formation of aqueous humor is dash
Pass.
microliters
Pass.
per
Pass.
minute. Onyx heminopic pupil is due to lesion
Optic
of
tract.
dash of visual pathway.
Optic tract.
Gene responsible for this condition seen in this picture is dash.
RBG.
What?
Retinoblastoma gene.
Okay, this is wrong. So let's see the answers.
Okay, best disease.
But now the first answer was wrong.
Best disease, okay.
So the answers are the rain cloud sign. It is seen in patients with endogenous candida and ophthalmitis. Muller's muscle is responsible for approximately 5 millimeters of eyelid elevation. That's false. Rate of formation of aqueous humor is 2 to 3 microliters per minute. And Wernicke's hemianopic pupil is due to lesion of optic tract. Gene responsible for this condition, the one which was shown was Best disease.
Best.
That was BMD2, bestrophin on chromosome 11. Thank you.
Thank you,
So
ma'am.
we
Two
go to the
correct.
next. Yeah.
They have two correct and one wrong. So it totals to plus 15.
Okay, ma'am.
Okay.
Thank
So
you,
the
ma'am.
next team is
I
Team
think,
RI Trivandrum.
Yeah, Dr. Shilpi, there is some lag, so you can give another 5 seconds extra because by the time you display the slides and Dr. Manisha spells it out, it takes time. So we
Okay.
can give them 5 seconds each for those things. Okay.
Sure, sir. Sure,
Okay.
sir.
Congratulations, House of Dragon. Now, the next team, please.
Team RIO Trivandrum. Team RIO.
Hello, sir.
We can't see you. Just adjust your camera. If the audience would love to see who are the quarterfinalists. Yeah, that's better. Good. Please introduce yourself and about your mentor, one sentence, and then we can proceed.
Good evening, sir. I am Dr. Gopika, third year resident at RIO Trivandrum. And Dr. Arun, third year resident from RIO Trivandrum. Our memory is silent, sir.
Okay.
Please
Remember what? Yeah, you have to speak loudly. Otherwise, if we don't hear you, you might not get the necessary 30 seconds, 25, 30 seconds, whatever that is allotted time for the rapid round. So be discreet and be louder. Okay?
Okay, sir.
Fine?
Okay.
Say loudly, yes.
Yes, sir.
No, we can't hear you properly. Please be closer to the mic.
Now?
Yeah,
Audible now?
better.
Loudly once.
Okay. Okay.
So remember, you have finite seconds once the buzzer starts. So remember, say either yes if you know the answer or just say pass loudly. Okay? Fine. Over to you, Dr. Manisha.
Thank you. So second round, we start with dash IL calculation formula is most accurate for short eyes.
Also, next.
Aspirin usage increases the risk of bleeding in patients with proliferative diabetic retinopathy.
True.
What?
Next
We
question, ma'am.
can't hear you.
True.
Percentage of developing non-arthritic IOM in the contralateral lines within 5 years.
Pass, madam.
Most important risk factor for development of diabetic retinopathy is dash.
Duration of diabetes, madam.
30 seconds, I think,
Are
so we can
over.
move on to the, just show the questions and we can answer. You can attempt an answer, but you don't get marks for this.
You can see some characteristic cells seen in this picture. You can see there are certain special cells. What are those?
Pass. Pass. Pass.
Okay.
So answer is Hoffer Q IOL calculation formula is most accurate for short eyes. Aspirin usage increases the risk of bleeding in patients with proliferative retinopathy. That is false. The answer is false. Percentage of developing non-arthritic ION in the contralateral eye within 5 years is 15%. And most important risk factor for development of diabetic retinopathy is duration. And characteristic cells seen in the picture below, shown just now, was Stoughton giant cells. That is for xanthogranuloma.
So they get 2 correct and 1 wrong. So it equals to plus 15.
Right.
So now the team 3 is focus freaks. Team 3.
Hello, madam.
Yeah. Come on, introduce yourself better. Come on.
Sir, Dr. Winnie, final year resident, Comtrust Eye Hospital, Kozhikode. And Dr. Fida, final year resident, Comtrust Eye Hospital, Kozhikode. And our mentor is Dr. Rohi.
Okay, good. Over to you, Dr. Manisha.
Okay, thank you. The third round, size of intermediate Drusen is dash micrometers.
Pass.
Rabinowitz criteria is used in screening of dash patients.
Keratoconus.
The fraction of HbF is inversely associated with the severity of
Pass,
ROP,
ma'am.
true or false.
Pass. Pass.
Topiramate causes dash type of glaucoma.
Angle closure. Induced angle closure.
The largest bone of medial wall of orbit is
Ethmoid.
Which part?
Ethmoidal bone, madam.
Which part of ethmoid bone?
you can
Okay.
specify, you can tell in detail.
Orbital.
Yes, great.
Yes, that's better. So size of intermediate Drusen is 63 to 124 micrometers. Rabinowitz criteria is used in screening of keratoconus patients. The fraction of HbF, that is fetal hemoglobin, is inversely associated with the severity of ROP, that's true. And topiramate causes secondary angle closure type of glaucoma. The largest bone of medial wall of orbit is orbital part of ethmoid.
So they answers 3 correct and 2 were passed. So total 30.
Okay, good.
So the next team is Ophthal Nerds Regional Eye Hospital. Team 4.
Ma'am, can you hear me, ma'am?
Yes.
I was unable to unmute my video. My video is not showing. Ma'am, can you see me?
No, we can't see.
We can't see you, but can you introduce yourself? Okay, you are from 2
I'm-
different sources.
Sir, 2 different devices, sir. My teammate is in duty, sir. That's why we logged in from 2 devices.
Okay.
She'll be playing along with me, sir.
Okay.
We are from Government Regional Eye Hospital, Andhra Medical College, Visakhapatnam, sir.
Okay, well played. And the other partner?
She's
Good evening, sir.
Yeah, be louder.
Can you hear me, sir?
Yeah,
Yes,
we can.
yes, we can.
Yes.
I'm Hanisha. I'm first year postgraduate from Government Regional Eye Hospital, Visakhapatnam.
Very good. Good. And your mentor?
she's our former HOD, sir. She got transferred, sir. Vishwamitra ma'am, sir.
Good. Okay, come on. Dr. Manisha, over to you.
Yeah, all the best, team
Can
4.
you tell your
Thank
name,
you.
please, once?
Sir, Vasvi and Gautami, ma'am.
Vasvi and Gautam. Okay. Okay.
So rapid fire 4. B wave in ERG, it arises from dash.
Bipolar cells.
Recommended HbA1c level for patients with
6.7%,
diabetes.
ma'am. 6.7. It is less than 7%.
On OCT, mustache appearance is associated with dash.
Pass.
Peptic ulcer disease is associated with cystinosis or myeloma, true or false?
True.
What?
True, ma'am. True.
And in Goldman 3-mirror lens, equator is visualized via mirror inclined at dash.
Pass.
So let's see the answers. B wave in ERG, it arises from bipolar cells. Recommended HbA1c level for patients with diabetes is less than 7%. On OCT, mustache appearance is associated with tractional lamellar holes. And peptic ulcer disease is associated with cystinosis or myeloma. That's wrong, false. In Goldman 3-mirror lens, equator is visualized via mirror inclined at 67 degrees.
So they attempted all the 5. 2 were correct and 1 was wrong. So it equals to plus 15.
Great.
Now the team 5, Astha Arun.
Hello.
Good evening, ma'am. Can you see us?
Yeah, we can see
Yes,
you.
we can
Do
see you.
introduce yourself.
Sir, I'm Astha. I'm final year resident from JIPMER.
I'm Arun Sahi, sir. I'm second year resident from JIPMER. Our mentor is Nirupama, ma'am.
How have you fused your images? Are you from different?
No,
Are-
sir. No, sir.
We are
Okay.
sitting together.
One, the half is background is white, the other half is black. And so
There's the
There's a curtain behind.
okay. I was wondering why is it so? I was wondering it's a 2 devices and you have merged the images.
No, sir.
No, sir.
And who's your mentor?
Nirupama, ma'am, sir. Nirupama.
Madam has logged in?
No, sir.
Okay. Come on. It's over to you, Dr. Manisha.
Yeah. Team 5, all the best to you. Rapid fire starts. Dose of bevacizumab is dash.
Okay. 1.5 mg.
0.5 mg, 0.05 ml.
PISA index is used for evaluation of,
Keratoconus.
as per Chandler's classification, subperiosteal
Three.
abscess occurs in dash stage of
Three.
orbital cellulitis.
3.
Vortex
False.
keratopathy does not interfere with vision.
True.
True.
Fluorescein angiography pattern is seen in macular hole. How does it look like?
Pass.
Pass.
So answers, dose of bevacizumab is 1.25 milligrams. PISA index is used for evaluation of keratoconus. As per Chandler's classification, subperiosteal abscess, it occurs in the 3rd stage of orbital cellulitis. And vortex keratopathy does not interfere with vision. That is true. Fluorescein angiography pattern seen in macular hole, obviously it is window defect. Thank you.
So
Well,
3 correct and 1 wrong. So it is 25.
Good. Yeah. So we complete with how many teams? 1, 2, 3, 5 teams.
5 teams.
Yeah.
Ma'am, the next team is
Yes.
matrix metalloproteinase. Team 6.
Hello, sir. Can you hear me?
yes, we can hear you. Please do introduce.
Sir, sorry, sir. My teammate is absent today. Like, he can't
No
attend.
issues. No issues.
Sir, my name is Dr. Mautika, sir. I'm final year PG from Sarojini Devi Eye Hospital, Hyderabad.
And mentor?
Mentor is Dr. Pratima, ma'am, sir.
Okay. So you're going to raise the battle all alone. Good. Brave heart. Best of luck.
Thank you, sir.
Ma'am, let's start.
Yeah. Team 6. All the best. So dash-shaped hemorrhages are seen in nerve fiber layer of retina.
Flame-shaped hemorrhages.
The needle sign in retina is seen in patients with dash.
Pass.
Optical cylinder in K-Pro implant is made up of dash.
Pass.
The Anderson-Castenbaum's procedure is a surgical treatment for dash.
Nystagmus.
Height of orbit on a width of orbit into 100 is, what is that called as?
Pass. Orbital index. Pass.
Ma'am,
Let's see the answers.
Ma'am, what about the 4th question? Shall we give marks or not? She said nystagmus only.
reveal the answers. Let Dr. Manisha take a call.
Yeah. Let's see. So flame-shaped hemorrhages are seen in nerve fiber layer of retina. The needle sign in retina is seen in patients with ocular amyloidosis. Optical cylinder in K-Pro implant is made up of PMMA. The Anderson-Kestenbaum's procedure is a surgical treatment for infantile nystagmus syndrome. So partially she was correct. It is up to Dr. Prashant and yourself, Dr. Shilpi, decide over. You are the judges, final judges for the show. I think I always go for the positivity.
Yeah, I think should give up.
Yeah, that's it. Height
She's
of
all
orbit
alone.
over width of orbit into hundreds is orbital index.
So 30 marks for this team.
Right.
Oh, the
So-
Lone Ranger really scored well, huh?
Yes.
So the next team is Team 7 Florets. Team 7.
Yes, ma'am. Ma'am, can you?
Be louder.
Good evening, sir. Can you hear us?
Yes, please introduce.
Sir, I'm Dr. Afika, final year resident from Aravind Eye Hospital, Coimbatore.
Okay.
Sir, I'm Dr. Dhanya, final year resident, Aravind Eye Hospital, Coimbatore.
So Chandrasekhar sir is your guide?
No, sir. Our mentor is
Karthik
Dr.
Kumar, sir.
Karthik Kumar.
Okay. Good. Best of luck.
Thank you, sir.
So all the best, Team 7. So we have a rapid fire. First question. Ectopic inner foveal layer is an OCT finding in dash. Ab interno trabeculostomy is a MIGS that causes dash nanometers xenon chloride excimer laser. For bilateral amblyopia, BCVA should be less than dash. The trial related to the emergence of perfluorohexane in the treatment of dry eye disease associated with MGD, that is meibomian gland disease, is dash. Which trial?
First.
Right. The ellipsoid zone is often intact in tractional lamellar hole. True or false?
True.
Let's see answers. So ectopic inner foveal layer, it's an OCT finding in ERM. Ab interno trabeculostomy is a MIGS that uses 308 nanometers xenon chloride excimer laser. For bilateral amblyopia, BCVA should be less than 6/12. The clinical trial related to emergence of perfluorohexyl obtained in the treatment of DED associated with MGD is MOGER. And the ellipsoid zone is often intact in tractional lamellar holes. That's true. So let's know what's the score.
One correct. They have attempted only one. So that is last one. So plus 10.
So well played to Florets. Now, next.
So I have the privilege to introduce our dear Dr. Nirutparna Diori, who's an MBBS DNB, and she's a consultant, Department of Pediatric Ophthalmology and Strabismus at Sri Shankardeva Nethralaya, Guwahati. She's one of the most skilled and trusted pediatric ophthalmologists in Northeast India. We all have listened her name, we know. She also happens to be the first fellow in the Department of Orbit and Oculoplasty from Sri Shankardeva Nethralaya, Guwahati. She is a recipient of prestigious APAO Achievement Award, recipient of International Hero Star Award for AIOS. She is an executive member for the YOC, that is Young Ophthalmologist Society of India, and she chairs the Assam chapter of YOC. She is also the issue editor of Your Times, Pediatric Ophthalmology issue. So, I welcome you, Dr. Nirutparna, for this big Q.
Thank you so much, Nisha ma'am, for your kind introduction. At the very outset, I'd like to thank Prashant sir and Shilpi ma'am for taking me into this platform once again. I'm really happy to be here. And I wish all the best to the participants. And with that, can we begin with the one-liners?
Yes, ma'am. So now the team 8. Team 8 is I Spice.
Spice.
So
Yeah,
you
we
can
can see you. Yeah, Spice, we can
Hello,
see.
good evening.
good evening, ma'am and sir.
Okay, introduce yourself, please.
I'm Dr. Priyanka Agarwal. I'm Dr. Aishwarya Mishra. We are third year residents from KMC Manipal, and our mentor is Dr. Shailaja, ma'am.
Okay, Shelja Bhatt.
Okay,
Yes.
Okay, best of luck.
Thank you so much.
best
Nilesh,
of luck.
all yours.
Yes, thank you so much. Shall we begin?
Yes.
So in Poshner-Skolsman syndrome, gonioscopy shows a dash angle.
Pass.
That's okay. Question number 2. The approximate dimensions of the optic chiasma
Pass.
for the length and the width. Okay. Which adrenergic receptors relaxes the smooth muscle of both the blood vessels as well as the bronchi? Which are the receptors responsible for dilatation? Okay. Cicatricial ectropion occurs due to shortening of?
Pass.
Okay. And the last question is, can you just identify what it is? It's a post graft. And can you just identify the arrow where it is pointing?
Those line.
Okay, correct. Correct. Okay, so we'll go ahead with the answers for this. So in Poshner-Skolsman, when you do a gonioscopy, you get an open angle, and the dimensions are 12 millimeter wide and 8 millimeter long. And beta-2 adrenergic receptors are actually present in both the bronchi and the blood vessels. So when you have a cicatricial ectropion, you have the shortening of the anterior lamellae, not the posterior. And the last answer was correct. So you get one correct answer. Shilpi, ma'am?
Yes, ma'am. Plus 10.
Okay, thank you.
So the team 9 is Twinkles.
Okay. So hello, team Twinkles.
Good evening, ma'am. Good
Please
evening, ma'am.
introduce yourself. Good
I'm
evening.
Dr. Kavya.
Introduce yourself, please. Okay.
I'm Dr. Niveda.
And
We both are secondary DNB residents from Aravind, Coimbatore. And our mentor is Dr.
who is your
Prema, ma'am.
mentor?
Prema, ma'am.
Okay. All right. So shall we begin with your questions?
Yes, ma'am.
Okay. All the best. Ma'am, can we have the questions, please? So the normal coefficient of variation in specular microscopy, is it pass?
Pass.
Did you say pass? Okay.
Pass.
The vortex veins drains into?
A superior ophthalmic vein.
Correct. The embryogenic origin of pupillary muscle is?
Mesenchymal origin. Mesenchymal.
Okay.
Pass.
Okay. What is rightidectomy? Okay. And number 5, can you, you have seen this picture, I guess, but working distance? Okay. So you get one correct answer. Can we go to the answers, please, ma'am?
Yes. One correct, one wrong.
Yeah. So the coefficient of variation is less than 40. Superior ophthalmic vein was correct. It is not mesenchyme, but it is a neuroectodermal origin. So rightidectomy is actually cosmetic facelift. And the working distance for charting this is 50 centimeter. Okay.
Okay, ma'am. Thank you.
So ma'am, one correct, one wrong. Yeah. Okay.
Now team 10, that is Ripples.
Ripples is really prompt. Very good. Come on, introduce yourself.
Hi, sir. This is Tisha. I am final year resident from Shankaraya Hospital, Coimbatore.
I'm Dr. Shana from Shankaraya Hospital, Coimbatore. And our mentor is Dr. Disha.
Congratulations. Welcome.
All
So
the
Dr.
best, and we shall begin your quiz. Yeah.
Pass.
In monofixation syndrome, number 2, incomplete and infrequent blinking in thyroid eye disease is called? The sign. Can you tell me the sign? Pass. So question number 3. In the human fovea, how many photoreceptors interact with one retinal pigment epithelial cell on an average? It's a pass, or did you answer?
More than 10 mm.
What is the size of a macropapillae?
More than 10 mm.
Macropapillae?
more than 10 mm.
10 mm. 10 mm. Okay. I think we should go on with the. So we could not finish the last question.
They can
but
answer.
this was okay. You can answer this. Can you identify this instrument? Okay, I'll give you a hint. It is used in phacoemulsification. Okay. Okay. Take it. So can we have the answers, please, ma'am? So it is less than 5 prism diopter. The microtropy is really small here. It is the Stellbox sign. Probably you have heard it many times, but today maybe you got a jumbled up. And it's 23 photoreceptors. And the size of micropapilla is not 10 mm. 10 mm is too large. It is 0.3 to 1 mm. And this is the Akahoshi pre-chopper. Okay. So
We will begin with the second.
there is one wrong, but
yes, minus.
I think only one wrong answer.
Yes, minus 5. Yeah. So with this, we move on to the second set of MCQs. So refresh your Kahoot platform. We'll start with the MCQs now.
So may I now invite Manisha ma'am for the next set of MCQs? Manisha ma'am, over to you.
Yeah, I'm there. Thank you. So
So
are you
shall
ready? Again, we are going to have MCQs. So first question. The Hedinger brushes phenomenon is caused due to which special characteristic of light transmission? Diffraction, polarization, interference, and scattering. Your time starts now. So the correct answer is polarization. The Hedinger brushes, they're used to test the foveal sensation. The phenomenon is created by rotating a polarizer continuously in front of a uniform blue field. A normal patient will see a rotating figure that looks like a double-ended brush. The effect is created because Hende's layer of the macula, outer plexiform layer, is oriented in such a way so as to polarize the incoming light. The finding most frequently associated with degenerative retinoschisis is peripheral cystoid degeneration, bullous retinoschisis, reticular retinoschisis, and rhegmatogenous retinal detachment. Time starts now. So the correct answer is the finding most frequently associated with degenerative retinoschisis is peripheral cystoid degeneration. So it is virtually seen in all cases of typical degenerative retinoschisis, that is the acquired kind of retinoschisis or a senile retinoschisis. This is usually seen adjacent to the chiasmus cavity. So now you have to select the correct neuronal sequence for intraretinal processing. Photoreceptor to Muller cells to ganglion cell. Second option is photoreceptor to bipolar cell to ganglion cell. C option, photoreceptor to horizontal cell to amacrine cell. And last, photoreceptor to horizontal cell to ganglion cell. So what is the correct sequence? Your time starts now. To Muller cells to ganglion cell. So the correct neuronal sequence is photoreceptors to bipolar cells to ganglion cell. So intraretinal processing, it occurs in this manner, and the modulation is done by the horizontal and amacrine cells, that is the outer plexiform, and amacrine cells, they are present in the inner plexiform layer cells. So next, hemorrhagic occlusive retinal vasculitis. It develops in a patient 5 days after an uneventful cataract surgery. What medication does the ophthalmologist suspect was administered intracamerally during the procedure? First option, cefuroxime, B, vancomycin, C, triamcinolone acetonide, and D is moxifloxacin. Your time starts now. So the correct answer is vancomycin. It's a HORV. It's a rare but potentially visually devastating condition that is seen after the intraocular injection of vancomycin. A similar complication it's not been observed with other antibiotics, and triamcinolone we know is routinely used intravitreally. So HORV, it just manifests after 1 day or so after the cataract surgery, especially when the one eye is having vancomycin and the patient develops some vasculitis in the periphery and hemorrhages. But when the second surgery is done, second eye sequential surgery is done, then there are more chances of getting this kind of HORV, and the vision is quite less. It is up to the hand movements or PL plus. This kind of vision is there. So the answer is vancomycin. Now the question is, a patient developed endophthalmitis 4 months after cataract surgery with a white plaque on her intraocular lens. What would be the most appropriate management of this condition? Option A, injection of intravitreal antibiotics. Option B, pars plana vitrectomy with intravitreal antibiotics. C is the pars plana vitrectomy and partial capsulectomy with injection of intravitreal antibiotics. And last option is topical antibiotics and steroids. Your time starts now. So the answer is, it's pars plana vitrectomy and partial capsulectomy with injection of intravitreal antibiotics. So we all know the clinical history is very characteristic of a case of a propionibacterium acnes endophthalmitis. The intravitreal antibiotics, they may clear the infection in up to 50% of cases. The most appropriate management is pars plana vitrectomy with partial capsulectomy with injection of 1 milligram of intravitreal vancomycin adjacent to or inside the capsular bag. Sometimes we need to remove the IOL also, and the capsular bag needs to be treated with, in this condition, with antibiotics, and observation is not appropriate for chronic endophthalmitis. We have to intervene. Topical antibiotics and steroids will treat the symptoms, but they will not completely eradicate the infection. So surgery is required along with capsulectomy as well as the antibiotics.
And with the second round of MCQs, now I again invite Dr. Nilutparna ma'am for rest of the this rapid fire round. Nilutparna ma'am.
I'm ready.
So the team 11 is team admit. Team admit.
Yes. Hello.
Hello, team admin.
Can you hear us?
Please introduce yourself.
Can you see us?
Yes, we can see you.
Okay.
Introduce yourself.
Good evening, ma'am. We are third year residents from SSMC Riva. I am Dr. Aditi Mishra and this is Dr. Tanisha. Under the mentor, our mentor is Dr. Pankaj Chaudhary. Mentor, ma'am, Dr. Pankaj Chaudhary.
Welcome to the quiz.
Thank you,
Yes, I got it. Okay, all the best, and let's start with the quiz. Can we have the questions, please? Yeah. What is the size of a giant papillae?
Greater than 10 mm.
Okay.
Greater than 10 mm. Radiation.
Okay, got it. Radiation wavelength range which enters the eye and reaches the retina in nanometers.
360.
Question number 3.
360. Difference between
And difference between a Norgels and a Hertel's exophthalmometer.
bilateral or you need single.
Sorry?
Maybe bilateral you can be used in both eyes and single.
Number 4. Okay. Yes, okay. Stage 4A ROP, does it involve the macula or it does not involve the macula?
Does not.
Okay. Now in this picture, can you tell me what is the Roper Hall classification for this chemical injury?
Grade of them.
Look at the limbus and look at the cornea.
Pass, ma'am. Pass, ma'am. Pass.
Okay. So we'll go to the answers. It is not 10 mm, it is 1 to 2 mm, and the range is 400 to 1400 nanometers. So what happens is that in Nogle's exophthalmometer, you have a forehead rest, but in the Hertel's, you only have the base rest on either side of your eyes, okay? And in stage 4 ROP, you were correct, it does not involve the macula, and this Roper Hall classification is grade 2, involving only the ischemia of the limbus, okay?
उसने वही तो बोला था सिंगल बोला था
कौन सा?
थैंक यू
कौन सा?
12 is
Okay.
side 7.
टाइप वो नहीं बताए मार्क्स कितने
नहीं आप
They attempted
okay.
4 questions.
Tell.
So they attempted 5 questions, 2 were pass, 2 incorrect, and 1 correct. So it totals to 0.
Oh God. Okay.
Team 12.
Hello.
Yes, we can hear you.
Okay. Yes, ma'am.
Please introduce.
Good
Ma'am,
evening, Site Sevens. Can you please introduce yourself?
Good evening, ma'am. I'm Jai Oswal. I'm third year postgraduate from Arvind Eye Hospital, Coimbatore. I'm Dr. Abhishek, first year resident from Arvind Eye Hospital, Coimbatore.
Okay, and
Who is your mentor?
Our mentor is Dr. Maheshwari, ma'am. She's a consultant in vitreoretinal department in Arvind Eye Hospital, ma'am.
Okay. Congratulations and welcome to the quiz. So we'll
Thank
start
you.
your one-liners, okay?
Yes,
Okay,
ma'am.
we'll start now. Okay. What is the normal hexagonality
Pass, ma'am.
index?
Pass.
Okay. Immunosuppressant that acts on cytosolic receptors and blocks the transcription of the cytokine gene.
Tacrolimus.
Okay. Grade 1 NVI involves how many quadrants of the iris pupillary zone? It's a grading system. NVI grading system.
2 quadrants, ma'am.
2 quadrants, okay. Name
Pass,
any
ma'am.
nerve involved
Pass,
in the
pass.
rhyditectomy.
Pass.
Anyone, okay. Okay. And number 5, question number 5. Name one modality of confirming the diagnosis you are seeing on this fundus photograph.
OCT. OCT.
Concentrate on the optic disc. Concentrate on
MRI.
the optic disc. Okay, fine, fine. So we'll have the answers for you. So the first answer is more than 60, and it is corticosteroids. Okay, and this you got it a little wrong. And this is less than 2 quadrants. It said 2 quadrants. Okay, but 2 quadrants goes to grade 2 actually. And any nerve you could have said either supraorbital or supratrochlear. And this is actually a drusen, so you can either see with the ultrasound B scan, but MRI also is a correct answer.
So, ma'am,
So,
what
ma'am,
about third answer?
can you?
Shall we give or what?
Third is actually if it goes to 2, more than 2, I think you can give it to them.
Okay, ma'am. Then it's
grade
1
2
correct,
actually,
2
yeah.
incorrect, equivalence to 0.
Oh,
Okay.
right.
Well played, Site 7th. Over to Sparkling Stars.
Now I invite team 13.
Good evening, ma'am. I am Dr. Meghna, JR3 from AIMS Nagpur.
I am Dr. Samarpita, JR2 from Nagpur. And our mentor is Dr.
So they are Nagpur teams. Dr.
Yeah,
Nirud.
Nagpur.
Who is your mentor?
Hometown.
Mentor? Dr. Purvasha ma'am and Dr. Pooja.
Okay.
Can you just speak once more, because if you answer and we can't hear you, it will be a problem.
Yes, ma'am.
Okay. A little louder. I can't hear you.
We
The
can't-
other, can you ask your friend to speak? Can you ask your friend to speak?
Can you hear me, ma'am?
Yes.
Yes. You are audible clearly, but we can't hear your friend.
Yes, ma'am.
So when you give the answers, could you be more louder? Okay.
Yes, ma'am.
So we'll start with the questions. So any one pattern of corneal graft that is made by intralis. Okay. Number 2. Question number 2. In glaucomatous cyclitic crisis, what percentage of the patients have HLA-BW54?
5.
Number 3. Question number 3. Essential infantile esotropia occurs due to high hypermetropia. Okay. What is the color of hypopyon caused by Pseudomonas? Very good. Question number 5. Last question.
9.8.
Can we have the last one, ma'am?
Ma'am, I have already displayed.
Can you? Sorry.
Already displayed.
Can you tell?
Pass, ma'am. Pass.
Okay.
Huh?
Pass.
They said pass.
Pass. Okay. Okay. So, can we have the answer? So with the intralace, you can make either a mushroom pattern or a zigzag pattern or a top hat pattern of corneal graft edge. And it is 40%, and infantile esotropia, it's not associated with high hypermetropia, it's false. Okay. So green is correct. And this is radial keratoneuritis. Okay.
One correct.
So I think, ma'am,
Plus-
they
So plus
one correct. One.
plus 5.
Okay. Okay. All the best.
So now we move on to Dr. Madhu sir for rest of the rapid fire rounds.
Yeah, I think we can have the next team, team 14.
Team 14.
Yeah.
Team 14, can you get your video on?
For you.
Team 14.
Team 14, are you there?
Team 14, can you hear us? I think
Ma'am, can you tell the name of the team? Please?
No clue crew.
it's Dr. Harshit Bansal and Dr. Abhishek from
PTMS Rohtak.
Rohtak.
Yes, sir, we are here, sir. Actually, sir, our team number was 11. So,
Okay.
yes, yes,
Okay.
Okay. So this is
get your
team
video
from
on.
Rohtak.
Yes, sir.
Okay, please on your video and we'll start with the questions. All the best.
Thank you, sir.
So we have video on.
So actually, battery is less.
So we are not able to start the video, sir, actually.
Okay. Fine. Please introduce yourself first. And your
mentor.
Good evening, sir. I'm Dr. Abhishek Sagar from third year resident from Regional Institute of Thermology, Rohtak.
So I am Dr. Harshit Bansal. I am also third year student from Rio PGMS Rohtak, sir.
And your
sir,
mentor?
And your
sir,
mentor?
Sir, our mentor is Dr. Manisha Nada, ma'am.
Oh, what's that, ma'am? Okay, I hope Dr. I'm sure, I'm rather than hope, Manisha ma'am has I'm sure about her integrity. Just best of luck.
Okay, right. So let's start the rapid fire for team 14. Okay, your time starts now. Name the criteria followed to diagnose early neurological field defect.
Pass, sir.
Okay. What is the classical OCT sign in idiopathic parafoveal telangiectasia?
Pass.
Okay. The only serological marker for Sjogren's syndrome is?
Serum SSA.
Okay. Which gene is involved in morning glory syndrome?
Pass.
Pass.
Okay. So what is the power in diopters in the central circular area? Your time is up, but you can still attempt it.
No, sir. Pass.
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 Okay. The answers, I think the first answer is RP Mills criteria, and the classical OCT sign for parafoveal telangiectasia is ILM drape sign. And the third answer is anti-SSA antibody. The gene involved is PAC6, and the diopter of central area is minus 64 diopters. So I think one wrong answer, you go to -5. That's it, ma'am. Shilpa, ma'am.
So third is wrong.
Third we did. Third we did.
Third is right. Yeah, so one right and one wrong. Yeah.
Sir, they didn't. Rest they all passed.
Yeah.
Yes, sir. We just answered one, sir.
They only answered one. So plus 10.
Plus 10. Okay. Okay. Right. Yeah.
Yes,
thank you, sir.
Yeah. So the next team is team
Team
15.
15.
Avengers.
Good evening, ma'am. Can you see us?
Yes.
Avengers from. Yes. Please
I'm
introduce.
Dr. Ajay, and this
I'm Dr. Saukanti. We are from Joseph Eye Hospital, Trichy, ma'am.
and our mentor is Dr. Deepak.
Okay. So team Joseph from Trichy. We'll start your rapid fire now. All the best. Yeah. What is the full form of COMET?
Pass.
Mechanism of action of moxifloxacin.
Broad spectrum antibiotics.
Okay.
It's a
Third, topical corticosteroids are most safely utilized in what period of alkali burns to the cornea?
pass.
Mutation in which gene is associated with juvenile open-angle glaucoma?
Pass.
Which is the type of nystagmus which may be associated with this defect?
Pass.
Okay.
Okay.
What you answered about the second question?
I just said it's a
Broad
broad spectrum antibiotic. It's a
What?
broad spectrum antibiotic they have told, madam. Let's see the answers. Yeah. So I think COMET is cultivated oral mucosal epithelial transplantation. This was like you do in this ocular surface. After SLET has come, this has not been much used now. Mechanism of action of moxifloxacin is inhibits the bacterial DNA replication. Topical steroids can be safely used in the acute phase, that is the first 2 weeks, where the inflammation is more. The mutation is TIGR or myocilin, and the nystagmus that was associated with the visual field defect was seesaw nystagmus.
So 4 pass and 1 incorrect.
Yes.
It is -5.
Yes.
Okay. So now the team 16.
Yeah.
Shreya and Kavya.
Do we have team 16? Yeah, please introduce yourself.
I'm Dr. Kavya. I'm Dr. Shreya. We are from Arvind Eye Hospital, Pondicherry. And our mentor is Dr. R. Naveen.
Okay, right. So are you ready for your rapid fire now?
Yes, sir.
Yeah, all the best. When is the World Braille Day? Which is visual prognosis of PSXG worse than POAG?
True.
The most significant modifiable risk factor of ARMD is?
Smoking. Cigarette smoking.
Moya disease is associated with what ophthalmic disorder? Okay, last. Which implant is used for which condition?
Aniridia.
Right. Let's see the answer. You have the iris behind already. Okay, so the first answer is Jan 4th, celebrating the birthday of Louis Braille, and which is the visual prognosis. Why is the prognosis of PXG worse than POAG? Because of higher IOP fluctuation. Modifiable risk factor is cigarette smoking. Moya disease is associated with morning glory disc anomaly. This implant is presbyopic correction. That's the implant you see in cornea. Okay. If it is there in the iris, then it is used for correcting aniridia. Aniridia, you have a prosthetic iris, or you also have a aniridia lens that has a black coating and a central thing that is clear. Okay. Good.
So 1 correct and 1 wrong. Right,
Yeah.
sir? Yeah.
Yeah.
So +5.
+5. Yeah.
Okay.
Right.
So now team 17 is ocular oracles.
Good evening, sir. Myself is Dr. Hasrin. I'm Dr. Megha Varnika, sir. We are from SDMC Kolar, and our mentor is Dr. Apurva, ma'am.
Okay. So team caller, all the best.
Thank you.
Your time starts now. Yeah, we can go to the questions. Height of the trableb is graded according to?
Pass.
What is the macular hole index?
I can't remember. Pass.
The onset of multiple cutaneous inclusion cysts around puberty is present in which syndrome?
Pass, sir.
A patient with piggyback lens develops a visually significant interlenticular membrane. What is the preferred treatment? Interlenticular membrane between two lenses. Time is up. You can still attempt the thing. What is number 3 in this diagram? 4, if you want, you can answer because that was there in the time.
Number 3 is?
They have passed, madam. 4, they have a chance to answer.
Oh, sir,
if they
time
want.
is up. They have
4
already
is passed, sir. This is
Okay,
LPS
right.
com-
So let's go
LPS
to the answers.
LPS.
Right. So height of trabecular is graded to multiples of corneal thickness. Macular hole index is base by height of the hole. Multiple cutaneous inclusion lesions is Gardner's syndrome. Piggyback lens is the only option is to removal of the lens. And number 3 in the diagram is Muller's muscle.
So
Thank you,
they
sir.
asked all the questions. So 0 marks for this rapid fire. So now team 18, I believe.
So who are the team members of?
I'm Dr. Sujay. I'm Dr. Gaurav. We are from Arvind Eye Hospital, Coimbatore. Our mentor is Dr. Narayan Rajpal.
Right. So team Arvind Coimbatore, all the best. And your time starts now. Let's go to the rapid fire. Zone alpha is larger and occurs more frequently in patients with POAG. True or false?
False.
In tarsal strip lateral canthoplasty, the strip is sutured. Occlusion of which artery results in lateral medullary syndrome?
Pass.
Which one of the following is most effective treatment for CME post-cataract in a non-diabetic patient?
Following seats. Topical NSAIDs. Steroids. Topical NSAIDs.
Most common complications seen with the below implant. The time is up, but you can still attempt this one.
Fibrosis.
Okay, let's see the answers.
So what about the first answer? What they said?
False.
Pass. You said
First
pass?
answer.
They said
false. False, ma'am.
Okay.
False. Okay, so the first answer they get it right, and the second it is sutured to the periosteum inside the lateral orbital rim, and artery that gets occluded is the posterior inferior cerebellar artery. Topical NSAIDs, I think we can give them the marks for that.
Yes, sir.
And most common complication is hypotony, not scarring.
So,
So
2
2 right
correct
answers, they get.
one wrong. So plus 15.
But our time was ended, ma'am.
Last one is they did not.
I gave the time. It is not. You should have said pass then.
Okay, ma'am.
Yes.
Right. So 15.
Team
So
19.
team,
Madam is very strict.
No, sir. If they have gave the right answer, they must have asked for the marks. Team 19. The strike.
Team 19.
Strikers.
Team 19. Do you names of team 19? I think we have.
Sir, am I audible?
Yes. Audible and visible. Go ahead and introduce yourself.
Okay. Sir, I am Dr. Manisha and my teammate is Dr. Smira. We are DNB residents from Thindai Hospital.
Okay. So all the best to you. So
Your
let's start with the questions.
Our mentor is Dr. Kamaljit Kaur Madan, ma'am.
Okay.
Dr. Kamaljit. Okay, right. Yeah, can we have the questions for team 19? Most common organism causing infectious crystalline keratopathy. It was in the MCQ.
Staphylococcus viridans.
Yeah. Which stain is used to stain Flexner-Winster rosettes?
Pass.
Multifocal ERG is used to measure electrophysical activity in rod-driven retina under dark adaptation. True or false?
True.
Ocular findings seen in child with fetal alcohol syndrome.
Pass.
Okay, you can attempt and identify this instrument.
Used in trab.
Yes. So what we call it?
Okay, let's see the answer.
Trab is called?
For opening the trabecular meshwork, I don't remember the name.
The name of the instrument, beta. Okay.
Right. So I think first answer they got it right. The stain is hematoxylin and eosin. False also they got it right. And ocular findings is esotropia. and this is called as Harm's trabeculotom.
So they said true basically, not false.
They told true, ma'am?
Yes. So it was the wrong answer.
Oh,
Huh.
okay,
Now,
right,
what
right.
about the last answer? What you suggest?
Maybe we can give them 5 marks.
Okay.
Trabeculectomy, they have told.
Okay. So it's one correct, one partial correct, and one wrong. So it totals to plus 10.
10. Okay.
Okay. Yeah. So now T20 is not there.
Okay.
So we will directly move on to the this MCQ round.
The
Okay,
last
ma'am.
set.
The last set. Yes, exactly.
Last by Niluptarna, ma'am.
Niluptarna, ma'am.
Okay. Over to you, ma'am, for the last.
Yes. Thank you so much, Dr. Madhu. Internet connection has announced. Okay, the first question is, which factor exacerbates corneal blood staining in traumatic hyphema? So the options are, it's A, shallow anterior chamber, B, heavily pigmented iris, C, high intraocular pressure, and D, persistent epithelial defect. So your time starts now. So the correct answer is high intraocular pressure, C. So moving on to the next MCQ. The most common complication of a conjunctival flap is A, flap retraction, B, hemorrhage beneath the flap, C, epithelial inclusion cyst, and D, ptosis. So your time starts now. So the correct answer is flap retraction. The third MCQ is conjunctival melanoma, at which location is associated with the best long-term prognosis. So option A is the caruncular area, option B is the fornicial, option C is palpebral, and option D is bulbar conjunctiva. So your time starts now. So the correct answer for this is option D. It is the bulbar conjunctiva. So last but before the last. So what is true about Crouzon syndrome? We just have to identify the true statement. It is inherited as an autosomal recessive disorder. Number B, the gene is FGFR2, which is on chromosome 10. C, proptosis is a rare feature in Crouzon's. And D, cataract and glaucoma are not associated with Crouzon syndrome. So your time starts now. So the correct answer for this question is option B. It is the gene FGFR2 present in chromosome 10. So moving on to the last MCQ. All of the following are true about essential infantile esotropia, except, so you have to find out only the false statement. A, option A, it has a large angle deviation of more than 30 prism diopters. Option B, it is often associated with nystagmus. Option C, it occurs due to high hypermetropia. And option D is there is no neurological deficit in essential infantile esotropia. So the time starts now. Okay, so the correct answer for this is option C, which we had discussed in our one-liners also, that it does not occur due to high hypermetropia. So I think with that, we have come to an end of the MCQs, ma'am.
Yes, ma'am.
Over to you, Shilpi, ma'am.
Over to Prashant, sir.
Okay, Shilpi, you can join us for the discussion.
Over to Prashant, sir. Yeah.
So, are we going to discuss, announce the prize winners in the private practitioner category, Shilpi?
No, sir, it will be next time.
Next time. So, can we have all the participants join us and also the mentors if they have logged in? We welcome the mentors. We can have a small chat with them then. I think the team people are there, young people. So, Madhu, we can have a chat, Madhu, Dr. Manisha, Dr. Nilotparna, we can have a small chat with this before we sign it off.
Yeah, I think overall the questions were also quite tough, sir, but still the teams played very well.
Oh, we have Dr. Purvasha with us. She's a mentor.
She's
She looks
always,
like
yeah,
a
yeah.
senior
She's
resident
always
now.
there with us, yeah,
Yeah.
on big queue. Yes. The participants were really active and smart, and they answered so well. I think Dr. Madhu, moderate to matlab thoda higher level tha. As
Yeah,
you were
yeah.
told that it should not be very easy questions this time.
Correct, correct.
So
Yeah,
you're
because
asked
it's
to
quarter final.
upgrade the level. So I hope the students they like the questions. Can
I
we
think
ask?
quiz masters are defending their, being bit harsh and being very
Yes.
difficult questions. I was asking the feedback from my poor students, you know. I would sympathize more with them rather than with, the quiz masters. They are all professional people. So, yes, Dr. Purvasha.
Even given a option, if I would have been one of the participants, even I was going through the questions and I was trying to answer them. Even for us, sometimes we have a glitch. I was like, oh, okay, this is not correct. This is not correct. Yeah, we do have that glitch.
So, Dr. Purvasha, my goodness, evening also you're seated with your postgraduate. It's 9:20. Let them be free and then have their own sweet time, yeah.
So we lead by example and inspiration. Our postgraduates are working hard with the mentors in brain teaser quiz like Professor Prashant Bankule sir and Shilpi madam. And these are our helpers, and he's senior resident in community medicine from JIPMER, and she is Dr. Priyanka, assistant professor in community medicine. We are working on a project. And when the quiz started, we all stopped everything and we've been glued to the screen. He's also answering all the questions. He's beat me to it in ophthalmology. So so just wanted to introduce Dr. Nishant. And he was very happy to see the team from JIPMER.
I know every year we have a team from JIPMER. They are always into the quarterfinals and almost to the finals, most of the seasons which we had. But welcome both of you. So, Purvasha, thank you for flattering. I love people flattering me. Even at the cost of Dr. Madhu, Dr. Manisha, and Nilotparna, because all the hard work has been done by them, and also to some extent by Dr. Shilpi. I'm more of a person who sits on someone else's glory.
You are the leader. You lead.
Yeah.
You lead.
You have created this wonderful platform, sir. Like now it has become like a habit now.
So let's have a non-ophthalmic chat with us. Dr. Shreya and Dr. Kavya. So how did you find it? How was the quarterfinal for you? Just go ahead. Don't look at the quiz masters. Tell me, how was the feedback for you?
It was a very interesting experience. So we haven't done something like this with a rapid fire round. So it was fun. It was actually fun.
Okay. So do convey it to your mentor. Who is your mentor? Have they logged in today?
No, sir. It's Dr. R. Naveen from the Department of Cornea and Arvind Pondicherry.
Yeah, he was from Madurai, Arvind, no? Naveen, Radhakrishnan.
Yes.
Right,
So,
right. Convey my regards to him.
Yes.
So sparkling stars. Your mentor is watching you. I think you will get a kadhi or sweets after you go back for your performance. I wonder. What?
It'll be tough, sir, but we managed to get.
Meghna, is your madam very strict?
No,
Who-
sir.
Pakka? No, no, she has now disconnected. You can be truthful.
No, sir.
Just pulling you. Well, you are. So she is a shining star from Nagpur, Dr. Manisha, Dr. Madhu, and Nirutparna. Both of them are doing extremely well. Most of the quizzes they are doing well. At local platforms are also both of them are doing extremely well. We are proud of you, and we would love to see you representing Nagpur in future as well. Hmm? Best of luck, better. Hmm? Any
Thank
other team members are there with us? Yeah, I think other people are shying away to be with us. So I think Shilpi, do we need to have any other program?
No, sir. The next quiz is next Wednesday only, quarterfinal 2 at 8 p.m.
Okay. Do we have a slide of the people who are going to participate?
No.
If it is there, we can just
No,
show
no,
it.
no.
Okay.
Sorry.
No issues. So it's time for us to say goodbye and sign out from our end. Thank you, Dr. Nilutparna, Dr. Manisha, and Dr. Madhu for preparing such a engrossing quiz for all the postgraduates. You have been kind enough to them, I know, and definitely it was quite a check for even our knowledge, at least to me. Thank you once more. And thank you all the postgraduates for participating, all the quarterfinalists, quarterfinal 1, and also looking forward to having next quarterfinal that is on the following Wednesday. Exactly, that is going to be on 27th. Same time, 8 p.m. Till then, it's time for us to say bye-bye. Thank you, Manisha ma'am. Thank you, Nilotparna. Thank you.
Good
Madhu.
night, sir.
Thank you.
Thank you, Dr. Shilpi.
Okay.
Thank you. Bye-bye.
Thank you, ma'am. Thank you, Madhu sir. Thank you, Nilutparna ma'am. Manisha ma'am.
And a
Thank
happy Holi too.
Same to you.
Yeah.
Okay.